Apprehension, uncertainty, waiting, expectation, fear of surprise do a patient more harm than any exertion. This is a quote from Florence Nightingale. That seems to sum up our collective response to this current situation. Regardless of role, title, health status, clinical expertise, specialty, or setting. We may experience fear, but we are still functioning as a united force with the goal of returning our patients to recovery and health. I pause to consider the current challenges across all of healthcare as we move through this pandemic to whatever our new future state will be. I am finding there are silver linings amidst all that has happened during this unprecedented time in our history. New and innovative practices emerge as we came together to manage this crisis. Things we previously did not think were possible are happening today. Our providers, including our advanced practice teams, have conducted over 5,758 video visits in March compared to 2,700 for the entire previous year in ambulatory care. Nurses are managing curbside testing at 3 specimen collection sites, helping to identify those patients in need of care. Over the course of 2 weeks, we have increased the capacity of our ICU beds from 107 to 267 beds to meet the needs of our patients, community, and the state. We have been extremely thoughtful about how we converted units to ICU-capable beds, which has required a new nurse staffing model to adapt to the new demands of the COVID-19 and ICU patient population. I am eternally grateful for your strength to pull together in such a time of need. Heavy lifting continued over the past week with opening of PACU as an 18-bed ICU. In addition, a tremendous team effort enabled the conversion of Mott 12 West to a 50-bed ICU, using the resources of our administrative teams, nursing leaders, facilities, HITS, pharmacy, supply chain, and too many others to mention. It all came together with speed and agility. A special thank you to all those involved. Our teams, patients, and community are grateful for your work. In addition, the mask reuse and reprocessing effort launched with the help of our scientists that tested and validated the process to ensure we are all safe. From there, the Central Sterilizing Processing Department developed standard operating procedures to collect and clean N95s and return them to the units. The process for reuse began with the units with the highest mask utilization and will be rolled out to the rest of the house over the next few days. Our supply chain team has kept us stocked with the appropriate PPE equipment and aligning with the World Health Organization and the CDC guidelines. Being wise on conservation has helped us maintain adequate supplies on hand for all of our care teams. Once again, this is only possible by working as a united front. I am so proud of how we've come together, and nursing has been unselfishly delivering care to our COVID-19 positive patients. We have reviewed the evidence and the science behind the transmission of this disease and have become active participants in educating the front lines as well as our community. We have in many ways turned things on a dime and have not missed a beat. Patients have come into us from other hospitals, entered our ED, or walked into our clinics, and you have had open arms for them and made them feel safe and secure. You may see fear in their eyes, and in spite of all your PPE, they have seen compassion in your eyes. Your healing touch, reassurance, and care has led to recovery of some of the sickest patients. You make a difference. Let's celebrate what we have learned about the strengths of this great organization and our nursing community as we move through this pandemic. We will share our stories and be around and grounded in the purpose of nursing to care for the sick, preserve health, and help others to a peaceful end when it is their time. You are all heroes. Thank you.